So we are going to go ahead and get started. Thank you for those who are online and then also those who are here in person. This is a co-hosted educational event with EPCMS, and I'll introduce Melissa Chismar from ChangeLine in just a moment. So those physician members of ours who have joined in, this is CME accredited. We did do that through Colorado Medical Society. This one is recorded and it will be added to the Colorado Medical Society's CME catalog. So share with your peers, let them know that this was a great educational offering and they'll be able to access that afterwards for about 3 years. We at EPCMS are very grateful to do innovative educational offerings and really reaching out to our physicians and beyond. And this evening is a great example of that. So I'm going to introduce Melissa Chismar. She is with ChangeLine. She came to us to say, hey, we really want to do this with your physician members. So
thank you, Natalie. Hopefully everyone can hear me all right. So my name is Melissa Chismar. I use she and they pronouns, and I'm the Health Equity Manager. So in my role, I oversee coordination of trainings and opportunities to bring our physicians and our healthcare workers together to learn about LGBTQ plus health equity and to learn from community members with lived experience navigating our local healthcare system. So this opportunity comes through some funding that we have from the state health department. So I want to give a shout out to them. Health equity is not the most popular topic right now. So the fact that this funding has been sustained through an administration change is exciting. And we're really grateful to be here and to be able to uplift this work and those in our community that really need to see those health disparities be reduced over time. So thank you so much for attending. And we'll go ahead and get started here. I will bring our other presenters up.
Hello, everyone. Thank you so much for joining us today. And the clicker, I forgot. So we are going to kick it off with some group norms. We're going to move through this pretty quickly as we've got a lot to go through. So if there are any questions about any of these, just let me know. Respecting is more important than understanding. What that means is that you might not understand someone's experience or identity, but you can still respect it. Be open-minded and assume positive intent. We want this to be a space where you can ask questions that you might be afraid to ask in other contexts. This is the place to ask. Be patient with yourself while learning new content. We'll just be going through a lot today. And, learning takes growth. And then be present, but take care of your own needs. If you need to use the bathroom, get some water. We've got sparkling waters in the fridge. There's the restroom. Coffee is in the coffee vault. But also, if you just need to step outside for a bit, that's okay. And then take space, make space. We invite you to join the conversation, ask questions. But if you know that you don't have any issues asking questions and jumping in, make sure to make space for people that are a little shyer. And then be attentive when others are speaking. Lessons lead, stories stay. What that means is that if someone says, oh, I had this experience in my practice and I'm wondering what I should have done or if I should have done something differently, and then you learn a lesson from that anecdote, you can share the lesson, but you don't want to say, oh, so-and-so had a person in their practice that da-da-da-da-da. We want to keep this space confidential for us to be able to share openly. And pictures are okay with consent, but please refrain from audio and video recording. Any questions? All right. Oh. Yeah, if y'all don't mind coming a little closer.
oh, thank you.
And apologies to the folks on Teams. I know I'm not exact, but I'm Nico. My pronouns are they, he, and I'm the outreach coordinator at Inside Out Youth Services. I help with a lot of the administrative work of our outreach, as well as organizing, different outreach for activism, such as our SMS line. And then I will hand things over to Ollie.
Certainly. Hi, y'all. My name is Ollie. My pronouns are they, them. If you're not familiar with the singular they pronoun, it just means you can say their name is Ollie, they have short hair, etc., what have you. I'm the advocacy director at Inside Out Youth Services. Nico and I were talking. We've actually both been at Inside Out 5 years this year, which is pretty fun. And what that means is really I oversee our incredible advocacy education and outreach department, work on advocacy strategy for the organization locally and statewide. And I will pass it off to Melissa, even though you kind of already introduced her.
Yes, I did. Thank you. But yeah, again, my name is Melissa. I use she and they pronouns. I work for ChangeLine, which is hosting this training this evening. There is a water fountain around the corner here, so if you need that, feel free to use it throughout the evening. And in my free time, I can be found hiking mountains.
Wonderful. And we will hear more from Ollie and Melissa very soon. First, I'm going to tell you a little bit about Inside Out Youth Services. We were established in 1990, which is pretty wild that we are now 36 years old. And we are the region's leading LGBTQ youth serving nonprofit. And we do that work through our community center, which is both in person and we have a virtual community center. And we also do a lot of outreach in the community because we know it's not enough to have one safe space. our goal is to make all of the Pikes Peak region a safe space for LGBTQ youth.
Thank you, Nico. And for those of you who aren't familiar with ChangeLine, we used to be known as Community Health Partnership. We rebranded last year to better suit the diverse array of services that we offer, but we are primarily a nonprofit civic hub. So we hope to see you back here for different convenings around unlocking, building, and channeling our collective power in this region to help shape the health of our communities. And we do that through various initiatives around suicide prevention, homelessness prevention, and health equity for LGBTQ plus folks.
Thank you. All right. So please take a moment. Has everyone had a chance to review the vocabulary handout in front of them? Yeah? Okay. Are there any questions that have come up as as you've looked over the handout?
I'll often use the word natal, female, or something like that. I'm a psychiatrist. You know that there. I mean, this mentioned some ways of saying that's a natal.
Yeah. I think that, natal might be one way to go about it, but generally we might say, female assigned at birth, because without getting too deep in the weeds of it, there are situations in which like sex itself is not entirely binary. And so, but we are in a system in which there is a binary assignment that is given no matter what, regardless of whether someone is born with exclusively male or female characteristics. And so assigned, I think saying the assigned female, assigned male, but we'll talk a little bit about ways to approach that question, especially when it comes to things like screenings and paperwork, to make sure that we're, respecting people's identities and the ways that they refer to themselves. Were there any terms on the sheet that you did not know before or anything, or any other questions? Oh, right. Got it. And for those on Teams, the question was about using the term natal female and what are some of the different terms to use when referring to someone's assigned gender at birth. If there are questions on Teams, would you see those? Yeah, okay. Then if there are no more questions, oh, did anyone learn a term they didn't know before? All right, y'all are very knowledgeable. We love to see it. So now we're going to talk about why it is important to create inclusive clinical environments, especially for LGBTQ people. So when we're talking about inclusive healthcare, we're talking about healthcare that comprises both environmental and interpersonal factors that enhance intrapsychic feelings of privacy, agency, comfort, and gender affirmation. Key environmental features include spacious, private layouts and culturally relevant symbols, which we will go into later about what some of those symbols might be. And interpersonal factors highlight the importance of culturally competent care. Participants noted that inconsistencies between environments and interactions do serve as a unique stressor. What we mean by that is that if you don't necessarily put, LGBTQ affirming, if your practice does not actually reflect that, because that can lead to issues with trust. So we're going to talk about how to make your practice reflect that during this training. So why do LGBTQIA2+ people need safer spaces? It's kind of a mouthful. So only 24% of LGBTQ+ youth can feel they can definitely be themselves at home. So there's some level of closeting or masking. Only 27% of queer youth can definitely be themselves at school. Well, about 30% of trans adults report being verbally harassed due to their gender identity, and about between 29 and 37% of LGBTQ+ employees reported experiencing discrimination or harassment at work, and then that has what contributed to 40% of LGBTQ+ employees report covering at work in some way to avoid discrimination or harassment. That might look like, toning things down in terms of like not presenting in a way that might be determined as gay, or not dressing as one's desired or like their identity, and trying to avoid any sort of uncomfortable issues with either coworkers or clients and staff or customers. And then 40% of trans adults report considering moving to more accepting places. We are in Colorado, one of those more affirming and accepting places. We have been seeing an influx of people moving here, especially as the states around us have become more and more anti-trans, which is why this is more important than ever to learn how we can care for the people that are coming here seeking refuge from draconian laws. So why do LGBTQ people need safer spaces? It's because affirming care opens the door to more regular preventative health appointments and follow-ups, especially when offered in a primary care setting, and that helps repair the harm from past experiences of discrimination and erasure. And unfortunately, as you are working with any member of the LGBTQ+ community, they have probably had to deal with issues of discrimination and erasure in the past, and that has to be repaired. And because we know that when people go regularly to get preventative healthcare, that improves their healthcare outcomes and their just overall lifespans, well-being long-term. So why might people be hesitant to get care? Ollie will tell you.
So yes. Oh, sorry, there's a tiny echo, so I'm going to stand farther from here so I can't hear it. Why might people be hesitant to get care, especially in the LGBTQ plus community? I forgot I had a clicker. So there are a couple of statistics here. I don't want to read through all of them, but just note that trans and gender expansive people tend to not see doctors in greater numbers when they need to, typically because of those past experiences of discrimination and erasure. 48% of people who took the survey, the 2022 US Trans Survey, had at least one negative healthcare experience because they were transgender. Sometimes this is misgendering, being referred to with the wrong pronouns, dead naming, being referred to with the wrong name, but it could also be being refused care or even outright abuse. So the scale here is very large. Only 8% said their routine healthcare provider knew everything there was to know about trans care. And of course, like not everyone needs to know everything. And one thing that builds trust is having a working knowledge of what does it mean to be trans, what kind of care do trans people potentially need, the questions to ask, the things to check in on, those kinds of things can really help build that trust. And finally, discrimination in healthcare actually doubles the odds of being in fair or poor health. So typically those who have experienced discrimination are also going to have worse health outcomes as a result. Now, this is for specifically the trans and gender expansive community, but it's also worth noting that the intersections of our identities also create additional barriers. So when I say intersections, I really mean someone who is trans and disabled, someone who is trans and has a chronic health condition, someone who is trans and Black, Indigenous, or a person of color. All of these multiply marginalized identities compound on each other. And so they may face discrimination for being trans in one space and for being a person of color in another, or worse, both at the same time. And so these additional barriers are also something to be aware of. Respondents to this survey had higher rates of negative experiences if they had a disability. And also there's an overlap in chronic health conditions. Trans people are more likely to have chronic health conditions, also potentially due to that, not seeing the doctor when they need to. Also, when we look at the racial statistics over here, we see that there are negative experiences for those who are trans and people of color at higher rates. We like to share this quote from Audre Lorde because it really hits on that concept of intersectionality, and that is that there is no such thing as a single issue struggle because we do not live single issue lives. We want to share this because it's just a reminder that your patients are coming to you with whole backpacks full of life experience, and you may be able to observe some potential life experiences that they may have had, but we never know what's in someone else's backpack. And we bring all of ourselves when we walk into your clinic, when we walk into your office, and so it's really important to just remember that kind of like holistic view of the person when we go through these things. So we have a couple of quotes about different experiences people may have had in healthcare that made them feel one way or the other. I would love a volunteer to read this quote because I'm going to be talking y'all's ears off today. Would anyone like to read this for me? Oh, wonderful. Thank you. Oh, okay, good. Oh, I'm so sorry. I didn't think about that. Okay. You were gesturing at my microphone. I was like, what are you talking about?
Okay, good. I went to have an ultrasound done. When I went to sign the forms, I noticed that one of them listed me as female. When I went in to get my ultrasound, I made sure that the ultrasound machine had me listed as male. I do not like having to check with various specialist office as to what my gender is before any procedure is done. I shouldn't be uncomfortable whenever I go to see my doctor. Ryan, transgender man, multiracial, age range 40 to 60.
Thank you so much for reading that, Micah. So this is an example of some of the barriers that people may encounter when they go in to get care, and that we may not recognize or understand as barriers unless we've experienced them, which is why we like to share these stories. So this is one example of why it's so important that systems talk to each other and that people talk to each other. So if someone's name or gender is changed in the system, making sure that every level of care gets that same information. So the person at the front desk and the person running the ultrasound, anyone who may interact with that person have the same information in their file. We have one more quote. Would anyone like to read this one for me? Yes, please. Thank you. Oh, yeah, no, here, you can have mine.
When I finally came out, my healthcare provider was one of my biggest supporters. She had treated me as a female and has made sure I have received all of the preventative women's health care afforded to me. I strongly believe she is responsible for me being here today.
Thank you so much for that. And yeah, this is an example of what happens when things go well. This is just a matter of affirming someone's identity, supporting them, connecting them to the care that they need, all things that you have so much power to do in your roles and can make such a big difference in people's lives that it may actually save their lives. So we like to share both so you can see how it looks when it works and how it looks when it doesn't. I'm going to hand it off to Melissa to talk about kind of these national statistics more locally.
Thanks, Ollie. So something that we have done at ChangeLine in the past year was survey the LGBTQ plus community at Pride events and through online platforms around their experiences navigating mental and physical health care. We received about 300 responses, so this is a statistically significant sample. But we found that of the folks that responded, about a quarter do not have access to a primary care provider. And the top reason for that was not knowing how to find an affirming primary care provider. In terms of insurance regulations, it's actually required in Colorado that insurance companies through Obamacare have to provide a list of providers that may match your identity, whether that's racial or ethnic category, sexuality, those types of things. However, it is optional for providers to opt in or out of that. And so there's not always a reliable way for people to find out that information. So something that we have at ChangeLine and PRISM is the PRISM Provider Directory, which lists affirming providers and also information about what insurance they take, their own identities if they're comfortable sharing. And that's searchable by age served, mental health care services, physical health care services. So that's something that we're doing to try to reduce that gap, but we still need more visibility. Interestingly, equity concerns, including fear that the provider will not respect one's identity, were cited as a top concern like over half the time by respondents. And this leads us to kind of a state that we've seen historically and still in present day, where people are often relying on outside of formal systems to access healthcare. This quote was in reference to some of the changes that we saw from executive orders happen in early 2025, but I'll read it aloud. People have self-managed hormones for longer than doctors have been managing them. I think that's really powerful, and it also gets at a historical condition that we saw with the first gender identity clinic that opened back in the 60s at Johns Hopkins. At the time, researchers there were gatekeeping, and that's a term that, if you're not familiar, just basically means restricting access of who can access services like gender affirming care. And I think the reason for that was that they were hoping to prove that it was effective. It wasn't necessarily malicious intent, but it resulted in, of the 2,000 different applicants who were conventionally attractive heterosexual candidates, only 24 went on to have gender confirmation surgeries. So that's a pretty narrow population that actually ended up getting care at that first clinic. So just an interesting fact to keep in mind. We still see some of that gatekeeping today, although it's gotten better. And something that helps within our community to alleviate that is ongoing communication. Word of mouth continues to be really powerful in the queer community. And we see on Reddit threads, on Facebook groups, people are constantly talking about the experiences they've had at different providers locally and finding ways to support each other through mutual aid and advocacy. But we're going to lean a little bit more into that with Nico.
Thank you. So for the last 6 months, I've been working on conducting research on our local community's history. And in that research, I found from a 1982 issue of the local digest Gay Speak. This was a publication that was circulated by the Pikes Peak Gay Community Center, which would later be called the Pride Center. We can see a moment in time where we didn't know what HIV was called. We didn't have the word for it yet. It was being called gay cancer, gay pneumonia, based on the symptoms that we were seeing. What's really important to note is the STD clinic that they name at the bottom, the 501 North Foot Clinic. That was a building with the El Paso County Department of Public Health, and there wasn't really an issue of Gay Speak that did not have an advertisement for this clinic. They really actively went into spaces that were like addressing the LGBTQ community to try to reach people and be explicitly inclusive. It's not enough to, simply be not bigoted, right? It's a matter of reaching out into communities and into those spaces and saying, there is a space to get this care, and that space is here. And so that is an instance from, pre-internet, the ways that we tend to find places now, which tends to be like Facebook groups and Google searches. And this was a way to reach the community at a time when there was a real lack of reaching the community. And we know that from the way that HIV and AIDS were treated by the government as a whole. However, as we are trying to navigate some of the inequities that come with being LGBTQ and living in a society that has these biases, we're dealing then with issues of accessing care, having the means financially to access care. Then there's also being able to take time off work, getting transportation. And that's where nonprofits like Point of Pride come in that help to fill in those gaps. And so knowing what resources are available can be really important as you're working with the LGBTQ community to see and know, okay, there are organizations that can offer funding if funding is needed. There are organizations that can help with logistics if logistical help is needed. So getting really familiar with that is really important. So what does it mean to create a safer space for LGBTQIA2+ people? So when we're talking, so we're going to be talking about this in the form of shared risk and protective factors. Risk factors are things that make it more likely that people will experience adverse outcomes, and protective factors are things that make it less likely that people will experience adverse outcomes, or at least make them more resilient should those risk factors appear. So when we're working with LGBTQ youth, something that we really try to emphasize is that youth who have a trusted adult, that's one trusted adult in their life, are at least 40% less likely to attempt suicide. Youth whose pronouns and chosen name are respected are around half as likely to attempt suicide. We really try to emphasize that fact, and that, you know, using people's names and pronouns, that does save lives. That is suicide prevention. And youth who have access to comprehensive sex ed are less likely to engage in unhealthy or risky behaviors that could lead to depression and suicide. I want you to remember these facts because, you know, you are going to be having moments with youth maybe once a month, once a week, once every year. It depends, right? However, you as a provider are in a position of authority. So when you are talking to parents who maybe don't understand and think this is just a phase, they're gonna get past this, or I don't really want to condone this, within your position, you can let parents know. And as part of your work as a caregiver, as someone who wants to see people healthy, you can let them know these facts, and that ultimately they have some of the biggest impact on whether their children grow up to be happy and healthy. 69% of trans adults with supportive families report having good health, compared to 56% without supportive families, and that's where we see some of those long-term consequences down the line. 98% of trans adults who had socially and or medically transitioned showed substantially higher levels of happiness, thriving, and satisfaction. That's really important to keep in mind, especially as there has been a push of this detransition narrative, like overblowing the rate of detransition and making it out to be like it's a much bigger issue than it is. These are what the stats say, and can you think of any other types of care that have that good of a success rate? And, you know, it's hard to think of any. So definitely not knee replacement surgery. That's a big one. And when we're affirming a trans person's pronouns, we can help lower depression and raise self-esteem and well-being, and reducing those stressors help improve health. But it's important to note that these different risk factors that are more likely when someone is queer, such as suicidality, substance use, sexual assault, suffering sexual assault or harassment, experiencing discrimination, homelessness, these are not inherent to being queer. They are inherent to being queer in a society that has systemic and interpersonal discrimination that is targeted at queer people. It's really about being amid stressors and having to deal with that discrimination that then leads to this. So in summary, experiencing discrimination, including the denial or dismissal of one's existence, increases a person's risk of developing anxiety, depression, substance use disorders, physical health problems, and suicidality. And affirming a person's identity significantly decreases their risk of self-harm and suicide. Now, how can we apply this to a clinical environment? Melissa will tell you.
Thanks, Nico. Sorry. So we're going to break this next section up into two pieces, and I'm going to talk to you about relational safety. And what I mean by that is essentially the relationship between a patient and the provider, relying on things like trust, good communication, and being able to navigate an inevitable power dynamic that exists. So I told you earlier that we surveyed LGBTQ+ community members. We also did a provider survey this year. It was a fairly small sample. However, most of the providers that took the survey did have a connection to the LGBTQ+ community, either identifying as such themselves or having a close friend or family member. So I think these statistics are really interesting because we know that the providers that responded, like, this is a salient issue for them. You know, wanting to treat people well that hold those identities is something that they're probably already thinking about. So the fact that we still see bias with providers, where that is something that's already salient, is powerful, and I think showcases that there's still work to do, right? We all have bias. So the most important quality I think as a provider to have is, in terms of being safe for your patients, is going to be receptivity to feedback. Safety is so much about being able to correct course when things go wrong, because they will, and being a person where you can ultimately self-correct. You know, if you were to get someone's pronouns or gender identity wrong, that's really powerful, and being able to kind of slow down in the moment, take a step back, and correct course and just move on with the interaction is one of the most empowering things that you can do for patients. We also think it's really important for providers to develop a working knowledge of a few philosophies of care, and I'm going to name those for you now. The first you've probably heard of. It's really popular amongst therapists and primary care physicians who are working with folks that are pursuing gender affirming hormone therapy. It's called the informed consent model. And by that, we basically mean that you're working with the patient to inform them of the pros and cons of any intervention or treatment that they're pursuing so that they can have the autonomy to decide if that's the right course of action for them, knowing that there may be some negatives or downsides to that. Harm reduction is another one. Before I came to work at ChangeLine, I worked for an HIV services organization, so this philosophy is really personal to me. But by harm reduction, we essentially mean that we need to be champions of realism as providers, that no one's going to have perfect health at any time in their life, probably. And so the things that we can do are really emphasize any positive change that we see amongst clients and patients. So maybe that's someone that has a big surgery coming up for gender affirming care and they can't quit smoking, but maybe they start a nicotine patch. And that is a form of harm reduction that reduces their cancer risk, for instance, or maybe the risk of a heart event after the surgery. And is something that you should absolutely reinforce as a provider. And the final philosophy is to be trauma informed. As Nico mentioned, not all queer people, but many will come into clinical spaces with a history of discrimination or mistreatment. And so it's best to behave as if that's true of everyone, and to just be sensitive around how you're asking certain questions, making sure people have information as to more invasive procedures or lines of questioning that you might be asking. So this ultimately comes down to using affirming language. So some key takeaways for that we emphasize are avoiding pathologizing terms. So hopefully if you maybe had any in your mind that you were using, the vocabulary sheet that we passed out and will send out digitally is something that you can reference for the future of kind of what the most up-to-date terminology is for different populations. We also want to recognize that the issue of medicalization with the trans identity in particular is something that comes with benefits and drawbacks. And by medicalization, I just mean the fact that with a diagnosis of gender dysphoria, people are often able to get access to things like gender affirming surgery and hormones. But there's also a lot of stigma that comes with a diagnosis like that and a lot of misunderstanding in public perception. People often think that being trans is the disorder, which is not the case. It's the distress people experience because of that mismatch, which I'm sure a lot of you know, but that's a huge issue that newspapers are failing to address adequately right now, for instance. Something that's also important to note is that when you see a patient trying to leave assumptions at the door, because transitioning is not always going to look like a step case for everyone. Some people might come in having socially transitioned with a new name or pronouns, or even legally doing so with a driver's license or something like that, but they might not be looking for medical or surgical affirmation, and some people will. And so just recognizing the diversity of patients coming in is really essential. Also look to your patients for the kind of language that they're using to describe themselves and their bodies. This is important with roles and identities that we might not think of as gendered, but typically are, like parent, caregiver, spouse. Those terms have wife, husband often attached to it, and that's not going to feel true for everyone. So when you can degender a term, that's going to be a best practice to use. And this might seem pretty obvious, but being able to distinguish, where you have maybe personal curiosity about someone or their journey from asking what's relevant to their care is going to be really essential for building that trust with patients and reducing any unnecessary questions. So an example from the sexual health world that I wanted to bring to y'all is this idea of the circles of sexuality. So a man who has sex with men might come in for STI testing or for a preventative health appointment. And this person could be attracted to men and have sex with men, but not identify as gay or bisexual. And perhaps that person's experimenting. Maybe they're not out. A term that I learned when I was in the HIV testing world was down low, which is specific to the Black community to describe that phenomenon. So it's, again, just something to be aware of, that we don't want to put labels onto other people that might not match how they feel about themselves. And that's also going to be crucial for ensuring that you get accurate health information from your patients. So I'm not sure if we define this in our terminology, but I will outline it for you. I'm sure all of y'all are familiar with SOGI, the acronym, but it stands for Sexual Orientation and Gender Identity Data. Research has shown that most patients want to share this with you, which, does anyone else find that surprising? I was kind of surprised. There's actually growing evidence to demonstrate that this is really important in actually bettering health outcomes, self-reported health outcomes for people who have a marginalized sexual or gender identity status. And so there's a few different ways to approach collecting this information. One of those is this should really be something that you're asking all patients or no patients, because you certainly don't want to single someone out based on their appearance or their demeanor. This is, yeah, as I said, this is something that should be asked of everyone or no one. And it's also really important to provide an opt-out or prefer not to say option. This isn't just to build trust with patients, but to be mindful of the socio-political climate that we're in, and physicians in other states, you know, and even there was the threat of this for youth in our state of being subpoenaed for health records of young trans people. And so with that climate and that being a risk that's really tangible for people, I think it's important, again, that you not press for this information if someone doesn't want to share it, but if they do share it, making sure that you're storing that properly and that it's accessible to everyone within your electronic health record. As Nico had stated earlier, we see additional trauma and distress happen when there's that mismatch between symbols of affirming care and inclusivity that someone might see walking into a clinic, like a pride flag, and the experience that they would have at the front desk or back in the clinic with a provider. I'll say one more thing before we get to this quote, and that's that to ask simply, like, who are your sex partners if you're a primary care provider might not be enough today, because it doesn't always get at someone's sexual orientation. So that's just kind of food for thought, because I know when I last went to my primary care physician, that's what they asked me. But it doesn't necessarily get at my identity, because I have, you know, I'm in a monogamous relationship with a man right now, but I am bisexual. So it doesn't really capture everything. So to feel seen, think of other questions that you might need to ask. We often hear this around Trans Day of Visibility, and unfortunately there's not an author that we can attribute this quote to, but I did want to share it, that visibility without protection is a trap. Again, getting at the climate that we're in, recognizing that anytime a patient who might identify as LGBTQ+ shares something personal with you, that's like a gift and a privilege, and they're also doing so with some inherent risk, even with things like HIPAA, just because of the climate that we're in right now, so that we need to tread carefully. All right, so we're going to move on to some best practices with physical health care. This first one you probably have heard of. It's a good rule of thumb. It's not perfect, but that's the screen what you have rule. So this is important when you might be asking things like a history of past surgeries, or if it might be appropriate to ask what someone's sex assigned at birth is for insurance reasons. We want to make sure that people are being appropriately screened for things like cancer and HPV, and the only way to do that is to know the anatomy that you're working with at the time of the visit. And so asking what body parts that person has then is going to be the best way to do that. Another lesson from the sexual health world is to provide reasoning when engaging in a more invasive procedure. Where I did STI testing, we offered sterile urine cups to everybody, but we knew that we would miss about 10% of cases of chlamydia and gonorrhea by offering a urine cup to people that had vaginas. And so that's kind of a pro and con to weigh, but something that if you were going to offer a vaginal swab instead of a urine cup, to keep that in mind and to provide that explanation to people so they know why you're opting for a more invasive procedure. And this is just some examples from social media of suggestions of ways that you could ask things. And a GAB is assigned gender at birth. And we also wanted to offer a quick prompt of what this could look like to be trauma informed, to have clear communication, and to provide explanation for clients. So contextualizing what information you're asking for, giving the reason why you're asking, and then ultimately asking for permission and allowing the patient or client to opt in or out is going to be the best way to go. Just some things to think about as we wrap up with this section. We talked about this a little bit, but that well-being is not just the absence of negative experiences or symptoms. It's important to make room for both joy and ambivalence when working with trans patients in particular. We talked about with harm reduction that no patient's going to have perfect mental or physical health, and the importance of allowing people to clarify, like if they're pursuing HRT, maybe what some optimal changes that they're looking for, not just like things that they're hoping to get rid of, is going to be important in affirming someone's gender identity. Fun fact, gender affirming care actually reduces HIV risk. Can anyone think why that might be the case?
People are more comfortable with their anatomy and are willing to, use the appropriate forms of protection as needed and things like that, rather than keeping it all mysterious or certain.
Thank you for that. So I think that's partially true. It ultimately comes down to like reduction of stress and feelings of affirmation, which will contribute to utilizing prevention methods, whether that's condoms, PrEP, those types of things more regularly. So kind of that reduction in stress when the primary health concern is taken care of. So yeah, kind of just a good reminder that oftentimes, not always, but sometimes the primary health concern for a trans or gender expansive patient could be getting that gender affirming care, and that other things can fall into place once that is taken care of. Also, it's good to keep in mind that our relationships to gender and sexuality can change over time. So it's good not just at the first visit with a patient, but semi-regularly, maybe once a year, to check in about pronouns, name, those types of things. All right, and I'm going to pass it off to Ollie to talk about environmental safety.
So delicate, I keep thinking I'm going to drop it. So the things you just heard about relational safety really are the bread and butter, meat and potatoes, whatever metaphor you want to use, the really important things to implement and keep in mind in your practice, in your clinic, in the work that you do. The environmental safety is easier to implement in a lot of ways, but it's also less effective. And until you have that relational safety, the environmental safety has to wait. Some of the things that we're talking about, because we're talking specifically about symbols of safety. We're talking about the things that you may say or do to indicate that you're LGBTQ plus affirming. And if you're not implementing that in practice, then again, we're going to have that disconnect between what people are seeing and what they're experiencing. So once you have those relational safety things in place, once you've worked through them, environmental safety that we're going to be talking about next is your next step. Now, someone's interaction with your work starts actually before they even enter the lobby. It starts when they find you, usually online in this day and age. And there's some things that you can do on your website to make it clearer that you are LGBTQ plus affirming. One, listing LGBTQ plus and transgender health issues as areas of focus or interest or expertise, if you do have that expertise. As someone who's been looking for LGBTQ affirming care basically my whole life, it is really hard to find the people that you need to support your health needs. The prison provider directories made it so much easier, but there's still so many people who don't know about it. So when I'm searching LGBTQ plus affirming provider, your page can be one of the ones that pops up, and that can be very helpful for folks. Be mindful of language that you may have on your website that is gendered, especially if it's something like a well-woman exam, right? There may be folks getting that exam who are not women or might not feel comfortable with that phrasing. You may have to use a certain phrase for insurance purposes, but you don't have to necessarily use that with your patients. And then consider videos to accompany staff bios on your website. This is just kind of good practice in general. A lot of LGBTQ folks also overlap with various anxieties or depressive disorders, et cetera. There's a higher prevalence in our community of those things. And folks with anxiety tend to really prefer that familiarity with a space or with people before going into that space or interacting with those people. So again, not just LGBTQ folks, but anyone who may have some of that social anxiety, just knowing who is this person I'm going to be speaking to, what are they like, even if it's just a 1-minute video of someone introducing themselves, even reading their bio aloud, is automatically going to put a face to the name and make people a little bit more comfortable. A virtual tour of your clinic or your practice or even your office would also be really helpful, because then people know about like the built environment that they are walking into. So it starts on your website, but then goes into the lobby. So when someone first walks in, there are a couple of visual cues that we may be looking out for to say, I am safe here, right? This is a place I'm welcome as myself. One of them is culturally relevant brochures or resources or signage. If you have pamphlets for LGBTQ plus affirming organizations or other resources in the community, then someone might see those and be like, oh, there's something here for me. So this is like a place where I am welcome as well. My clinic, the primary care clinic I go to, actually has a Progress Pride flag printed over the words thrive. And every time I see it, I walk in and I'm like, oh, this is a place I get to be. And that's really nice. So it's just little things like that that can make such a big difference for people's comfort, especially if it's their first time walking into your space. Access to gender-neutral restrooms are so valuable. You're probably going to have a family restroom in a big enough building, but you may not. But gender-neutral restrooms are really just good practice for everyone. It takes away that pressure of having to decide which box you're going to try to fit into that day, if you're going to risk being discriminated in one restroom or another. There's a lot of stress that can come with just choosing the right restroom. And taking that stress away by offering a private gender-neutral option is really helpful for folks. And then inclusion of pronouns on name tags, in your email signatures, things like that, having little pronoun pins on your lanyard. It may seem really simple, but this is such an amazing way to open doors for people to self-identify. It can be really hard for LGBTQ folks who use alternative pronouns or pronouns you may not expect to say like, hey, this is my name and these are my pronouns, because they don't always know how someone's going to react. But when you say, hi, this is my name and these are my pronouns, then there's automatically that door opened. They have the opportunity to say, oh, this person knows what they're talking about. They're familiar enough with the concept. And because they're familiar enough with the concept, I can trust that they're going to try to use my pronouns correctly. I want to be clear with the word try because we all make mistakes, totally natural, completely fine. But the effort is really valuable. That's what people are really looking for. There are some symbols of safety that we have here. A couple ones that you may be familiar with already. The Progress Pride flag I mentioned earlier. This is the currently most inclusive version of our Pride flag. Every once in a while, new ones will come out. Always good to keep up on these things. Next to that is the pink triangle. This was actually a symbol used in Nazi Germany to designate homosexual men that was reclaimed around the 80s and has since been a really powerful and subtle symbol for LGBTQ plus support. So especially if you're working in a system where you may not be able to outwardly display things like a pride flag, a pink triangle can be a more stealth way to say, I am here and I am supportive for you. Pronouns I already mentioned, but having the name tags, the pins. Signage in multiple languages is also really good. There may be someone who walks into a clinic and doesn't see anything in their first language and automatically feels kind of that sense of separation or otherness. But when you have signage in multiple languages, even if you don't necessarily have all of the services you provide in those languages, just having that visual signal that people who speak different languages or are from different countries are welcome here can be really cool. And then, of course, the accessible signage for accessible parking spots, restrooms, very important. I want to be clear, though, don't put this sign up unless you mean it. This is a great way to indicate that you have these amenities, but having those amenities, the ADA accessible restrooms, the ramps, is the most important part. Just when you do have those things, signal them clearly so folks know, yes, I'm in a wheelchair, and yes, I will be able to enter and access this building. I do want to caution on the everyone is welcome here. This is a really popular and common refrain, and it's beautiful, right? We love to say everyone is welcome. And there have been a lot of instances in which LGBTQ folks have walked into a place that said everyone was welcome and realized, oh, I am the exception to that rule. Everyone but me is welcome. And we never want to put people in a space where they worry that they're the exception to the rule. So if you're going to have things on your website or in your space that say everyone is welcome, maybe just enumerate who it is you're talking about. So for instance, everyone is welcome here regardless of age, race, gender identity, sexual orientation, et cetera. Or everyone is welcome here, including LGBTQ plus people, BIPOC individuals, people with disabilities, et cetera. Just listing folks and enumerating them will really help people understand, like, this is exactly where I fall in the everyone, so that uncertainty kind of goes away. Some other best practices, and these are part relational, part environmental. Avoiding gendered language when addressing folks. This can be really hard for my friends in the South. Love the ma'ams and the sirs, but things like ma'am and sir may automatically put an assumption on someone. I've been on both sides of the man versus sir debacle, where like someone uses the wrong one and then it's really awkward, and we all hate that interaction. Everyone hates that interaction. So removing those kinds of like gendered assumptions are really helpful for folks to then self-identify. Ensuring consistency, we talked about this before, we'll talk about it again, between paper forms and your systems, consistency across your systems, so a patient's information is updated everywhere. And then understanding and communicating when and why legal name or sex assigned at birth are necessary. As LGBTQ folks who have changed names but maybe not done so legally, we're well aware, like there are going to be times where I have to write my dead name on a piece of paper and I hate it, but I'll do it. But if you just let them know, like, hey, I need your legal name on this for this reason. I need to get your sex assigned at birth on this form for this reason. That can really take some of that, like, oh, I have to do this thing and it sucks and I hate doing it. That can take that out of that equation because then we understand the reason and we can be like, okay, this is something I have to do. And so like, I'm not going to worry about it too much. So that communication is key. Some other best practices. Ensuring staff at all levels and at all roles are trained to be LGBTQ plus knowledgeable. They don't have to be experts. You don't have to be an expert, right? Again, respecting is more important than understanding. We don't have to understand everything about the LGBTQ community, but making sure anyone who may interact with your patients is at least knowledgeable in some of these best practices, right? Using people's chosen names and pronouns, avoiding gendered language. Both Inside Out Youth Services and ChangeLine offer tons of trainings around these topics. If you want to just do like an all-staff training about what pronouns are, we can do that in 45 minutes with a smile on our faces. So please feel free to reach out if that's something that you'd like. Also, just a reminder to consider how LGBTQ plus identities may intersect with other identities. So again, those multiply marginalized identities, understanding that people may have different experiences with healthcare based on their different life experiences due to their identities. And then forming partnerships with LGBTQIA2 plus organizations. Gosh, it is a mouthful. I'm always trying to see how quickly I can say it. Sometimes I can do it real fast. Sometimes I stumble. We tried. So form partnerships with these organizations. Just by being here tonight or by being on Teams tonight, you're already doing that by taking this training. And we are here not just for you this evening, but as a resource in perpetuity. So if you have any questions, if next week someone comes to you with a situation and you're like, oh gosh, I don't know how to handle this. I really wish I'd had this happen before the ChangeLine training. Please just get in touch with us. We are more than happy to be here to support you afterwards. Today, tomorrow, 6 years from now, you name it. Some interpersonal steps that you can take as an individual. These are things that you can do not just in your work, in your practice, in your clinic, but also just as a person navigating the world, right? Using LGBTQ inclusive language, as we've talked about, and reducing gender separation and stereotypes. We train a lot of teachers and educators, and we'll often talk about that, like separating kids into the boys group and the girls group. That can be kind of damaging to have that separation, because even folks who may be cisgender still may feel like all of my friends are in the boys group. Why do I have to be in this one? There's just like a separation that automatically happens there that is actually proven to not be good for people's mental health, no matter their identity. So reducing as much as possible the gender separation and stereotyping. Asking for people's names and pronouns, sharing your own, respecting them once you're aware of them. We already talked a bit about pronouns. Happy to get more into it if you'd like, but for now, I'll move past this one. Becoming familiar with LGBTQ+ terms and identities. You have your handout there. This is by no means an exhaustive list, but you're welcome to take that with you as a resource. We tried to make the second page pretty, so you can put it up as a poster if you'd like to. And if you want a prettier one, just let me know and I can send you one with a cute blue background. And then also practicing conversations. This is a really important one, especially for those of us who may feel kind of like pressured on the spot if something happens we're not expecting. Practice like, what happens if someone comes out to you, right? What are you going to say to that person? What happens if someone tells you that they have trauma related to their medical care in the past? What are you going to say to that person? Just ways that we can kind of talk through these things before we encounter those situations, so we're better prepared in the moment to support that patient. Starting, joining, or supporting an employee resource group or a similar group is another great thing to do. These are affinity groups that employees can join, one, to find like-minded folks within an organization, and two, to really influence organizational culture. So if you already have one, amazing. Maybe just pop in and be like, hey, what can I do to support? You know, is there something I can do to help? Or if you don't already have one, consider starting one or finding folks who may be interested in starting one. And then finally, preventing and addressing instances of discrimination or harassment when you become aware of them, including a zero tolerance policy on hate speech and the like. UC Health has a really lovely set of guidelines in all of their lobbies. Highly recommend checking it out. But it just sets those expectations right off the bat that like bigotry, hatred, harassment are not welcome. Stepping in when you see something can be really uncomfortable. And you may not even know necessarily that what you're seeing is discrimination or harassment if you're not familiar with some of the microaggressions that the community may experience. And that's okay. I always recommend just stepping in anyway. Just say like, hey, you know, that is not something that we say here, or hey, this person uses they, them pronouns. Just those little things to indicate to that person that like you notice and you're there to support, and that these things are not tolerated. So if it is a serious thing that is happening, then you have proven yourself to be trustworthy in that moment. I often use this example, real fast one, because I know we're hitting up on time, but there was one time I was sitting in my backyard and I heard these kids shouting from my back fence. And I looked over and I saw this one kid pushing another over and taking his bike. And I was like, oh, no, this will not stand. So I like came storming out my back gate. I was like, kids, what are you doing out here? Like, what's going on? And they were like, oh, we're playing bike thief. And I was like, oh, never mind. It's fine. This was not an instance of actual bullying. They were playing a game. But I think it's good to step in those moments, because if it had actually been a bullying incident, then there may have been something that an adult could do in that situation. All right, so we're going to do some wrap up here, and then we're going to get into some other activities and questions. First off, we're going to give you these slides so you can click on all these things. You don't have to write them down. Tons of resources here for other tips, tricks, things that you can do. Further reading, if you'd like some further reading. We have 2 pages of references. I would be here all night if I tried to read them all aloud to you. So just know you're welcome to go through our sources if you'd like to see where we got some of the data and information for this training. And we're going to take a mindful pause because we just threw a lot of content at you. So give yourself time to kind of think about what we've talked about tonight. Please feel free to write down a question, share it with your seatmates or someone nearby, or in the chat on Teams. And we'll come back in maybe like 2 minutes or so, and answer some questions. Thank you. Just gonna leave it. Launching the questions. I just wanted to draw y'all's attention to our email addresses on the screen. Please feel free to take a picture of this if you want to. But we'll again also have these slides. But we are a resource for you after this as well. So if we don't get to your questions tonight, you can send it to us. So yes.
We do have an online question. So you ready?
Great. Oh, and I forgot to hold my mic. Yes.
All right. So it says, I work with children and adolescents in the public school system in a fast-paced environment. I have 5 to 10 minutes with them. Is it okay to wear a pronoun pin but not specifically state my pronouns verbally?
Absolutely, that's more than okay. Yeah, if you have time, if you feel comfortable doing so, stating your pronouns verbally is great, but it's also not like fully necessary if you have a visible pronoun pin. I know for me, I'm always scanning people's lanyards to see what their pins are, even if it's just like, oh, I want to see what anime they're into, you know? So just like having that visible is also like a really good way to open that door.
Thank you.
Yeah. Any other questions? And I'm gonna please step in, y'all, if anything comes up. Yeah, we'll do a little pass the torch. Yeah.
I'm a psychiatrist in private practice. I have a microphone.
Yep. Thank you.
I'm a psychiatrist in private practice. So in my office, I've considered having things like symbols of inclusivity and, all are welcome sorts of signage, although there are, and I see many transgender folks, many LGBTQ plus folks. And I also see very conservative folks or MAGA folks that if they came in the office and saw those symbols, that would be the topic of our session, like that it would actively make things difficult for them. So in the end, I just ended up being relatively neutral. I don't have too much one way or the other of that kind of symbology. The thing of everyone is welcome, I guess, is a potential relatively neutral starting place. Do you have any other thoughts about like kind of more subtle or less overt symbols of inclusivity that I could have in the office?
Would either of y'all like to take this first?
It's a tough
question.
Yeah.
Yeah, that is a really tough question. And I would say, the pink triangle can be one that is like kind of in the know.
Right.
Sometimes something we've seen is people getting like posters that have pride color flags, but aren't explicitly a pride flag, but like people, it's sort of that like recognition of like you see certain colors and like what that is. But if you but you might not explicitly say it. It's a tough one, right? It's sort of that like speaking in code thing. But what I would also say is that sometimes it is important to take a risk for what we know is right. And I understand not wanting to other any patients, and I think that makes total sense. But I think maybe if you put up a symbol and someone had feelings about it, one, they might just take their business elsewhere if they're like, our values are not aligned, But also if it does end up becoming a conversation, maybe sometimes I think that often people in a position of like medical authority, but also if you're in a position of you're working with someone and they might not know your identity or they might see you as like them, and then you can sort of open up a dialogue, which I know as a psychiatrist, you only have so much time. I know my psychiatrist meetings are like 15 minutes. So I understand that there's not that much time, but being able to, open up that dialogue within a space as a trusted provider, sometimes it's something deeper. I mean, we've seen how often, bigotry is just repression, And so being able to create space for people to say, so what is coming up for you, while that might be more of a therapist role, but still. Yeah, so I would say it's maybe worth giving it a try. And then if it does become a conversation, you really never know what might come up. Any other thoughts?
I +1 what both of my friends said here, but I would also say, like, if you're comfortable with smaller symbols of inclusion, like your own pronoun, we have pronoun pins in that little black bucket on the table over there, so feel free to take some for anyone you work with too. But that can also be a nice subtle way to symbol inclusion that isn't maybe as overt as something that's in your waiting room too. So yeah, we're putting on your website. I know it's so different, like having worked in like a public health space, like we have to serve everyone and everyone comes to see us because we're free, so it's a little bit different when you're in private practice and you're trying to recruit clients and patients. So, but thank you for asking that question, because.
Any other questions? None from the chat? I've been taught to wait 7 seconds after asking if there are any other questions, but y'all seem pretty confident, and there's only 3 of you, so I can say that with certainty. So we will cut it off for now.
We will just pan. We have one more slide, and this one is just for y'all to kind of consider some of the resources that we've given you today. You don't have to share this with us, but it might be something we ask in a follow-up survey a month from now, is if there's something that you learned today that you're going to incorporate as a best practice with your patients going forward, take a look at that. Nico is also going to pass out some other questions to consider for your practice, more like organizational culture type of things, and that can be a great resource as well. But as stated earlier, we're happy to continue a dialogue with you or your practice. And thank you so much for coming today and your attention. Thank you.